very pertinent question here. What contraindications should we be aware of? What damage can the laser do if it's used incorrectly?
When we go and demonstrate it, you'll see that we'll be wearing goggles. Okay. So any class 3B, even a class 3A laser, and definitely a class 4 will require goggles, and they're protected with filters. And they're specific for the individual machines. You can't just go and buy a pair of goggles on the internet. They need to be for that machine, based on the power of that laser, based on the wavelengths, based on that protection. So that's one thing. And the reason being is, like normal light, your lens and your corneal will concentrate at the back of your retina, and it will concentrate to the level that it might actually damage your retina. So the first thing is you need to wear goggles.
Is that... you said it might actually damage the retina. Is this something where it's been proven to cause damage, or are we just saying we better take care?
It's one of the most structured things about lasers. There's a thing called OD, which is optical density, and depending on the power of the laser, depending on the wavelengths, it will have an OD factor that you must adhere to on the lenses that you are using. You want to have it thin enough that you can see where you're aiming the laser, but not thin enough that it's causing any damage in that respect. And there are radiation and laser safety officers who will advise you about the structure of your clinic and which is the best room to have it in, and all the other aspects of that. And that's an important factor.
I remember a fellow osteopath setting up, I think it was going to be a laser tattoo removal clinic, and they had to make sure they had no reflective floors or mirrors or anything else in the room. That's the case?
There are similarities in regards of that. It's less of an issue, but yes, you would need to adhere to blinds, for instance, if you're front facing to the main street, just to make sure that nothing's reflected out there. It's not going to penetrate beyond clothes, so it's safe in regards to that. And if any of your staff or you're treating someone who's pregnant, it's safe to treat them as long as you're not doing it over the abdomen of the pregnant person. But it's a safe modality in that respect. Because it's a photobiostimulator, there was some work, and I'll show you this, which was looking, and this is a slide which we actually published quite recently. People in the past were thinking, do not go anywhere near cancer. And we still are hesitant about advising anyone to use it on cancer. But increasingly, like this piece of research that we did over there, this is a mouse model, but we've also done work in children with squamous cell carcinoma of the mouth. And we've shown that it stimulates the immune system to actually attack the cancer cells without stimulating the cancer cells to grow. Now, we've only done it on melanomas and carcinomas in the mouse model and in certain children. There was a big multi-center study in Italy of 100 children where they did it with squamous cell carcinoma of the mouth. But the fact that they're showing that is totally contraindicated. If we'd spoken 5 years ago, I'd have said, don't go anywhere near it. Now in the NHS, we are treating women, especially after mastectomies, who've lost all their lymph nodes and have very significant scarring. And with their consent, we are now treating them to reduce scarring, to get the range of movement, to get the edema down without creating cancer cells or even stimulating maybe any of the marginal cells that are there. And that's a massive change in 5 years.
It sounds as though it's still a bit fringe.
It is.
So how long before it's being nice promulgated, as it were?
I would say we're still a good 5 years away. But there are pieces of equipment being developed at the moment where you literally walk in, having had your radiation therapy, and then you walk into the laser. So in the 5 years' time, if we were speaking again, I'm sure that there will be machines that on the market for oncologists especially to be using as part of the rehab during chemotherapy, radiation, surgical procedures.
What's the most common use at the moment in the NHS for laser?
The most common is just rehabilitation post-surgery, and also for chronic things. The biggest use in the NHS is for hands. And you kindly said that vets are good at anatomy. I realised how bad I was at anatomy until when I went to a hand therapy unit. Right. And the complexity of someone's hand made me feel very humble in regards to what I used to do to dogs in regards of my surgery. Mm-hmm. And the amount of both the tendons and ligaments, but also the nerves and the annular ligaments, mean that the concentration of problems you get and accumulate over life is quite high. And therefore in the NHS, something like Guy's and St Thomas's, that they have 30 physios and OTs working, and they have 2 of our lasers working there, and they're using it in conjunction with the rehab and pain management. Some post-surgery, but the majority are tertiary referrals where they've had 20 years of carpal tunnel or something like that. Yeah. And we're using it in those scenarios along with trigger fingers and de Quervain veins and really nasty intrusions, fasciectomies, and a whole range of really nasty conditions within the hand sector.
You're seeing some resistance from the consultant surgeons in those fields?
Ironically, there was initially until we started treating them. And then all their own ailments, which they weren't injecting themselves with steroids, surprise, surprise, yeah. They started seeing the benefits of the laser therapy. And in seeing the benefits, then they were the ones who were the chief advocates to go and get it within the department because they control the purse strings.